is a 24/7, 365 initiative that works to destigmatize talking about mental health. And that's always our goal here, getting people to feel comfortable acknowledging what's going on for them emotionally and also talking about it, giving others permission to feel their feelings. That's how we're going to get through this pandemic. We got a great show planned for you tonight. We have Jessimae Peluso. She's a comedian and also the Sharp Tongue podcast host, as well as Dr. Kristen Gibson. And we'll be talking about feeling more secure and reducing anxiety around food choices in terms of delivery and going to the supermarket, because right now that is a part of everyone's mental health. So I wanted to start the show by talking about forms of coping. Now, we talk a lot about things like self-care, and I'm watching everyone on social media and they're posting their pictures of their baking and their shopping and their drinking. And the therapist part of me is saying, listen, on the mental health end, it's really important that we're letting go a little bit, being looser and more kind with ourselves, not being as heavy-handed with the structures and the boundaries, but we also do still want to consider the impact those coping, self-soothing, and self-care choices are going to have on us in the long term. So I just want to remind everyone that self-care is always going to be about activities, behaviors, and choices that leave us feeling better. The whole point is for it to ground us, support our mental health, soothe us, heal us, comfort us, all those good words. So if whatever choice you've made around what's going to be a cope mechanism, make sure that it's not leaving you feeling worse off or more negative, right? So it's all about the mindfulness. I tell people check in before, check in during, and check in after. Did that make me feel good? At least neutral, but it shouldn't be things that are making you feel worse off, because that means they're not falling under self-care. They're actually kind of working against you. And right now, more than ever, we have to be paying attention to our mental health, but also our biological health. And those two are powerfully tied. So just again, we're care and compassion is our word. We're wrapping around all of our choices. So lovingly examine the decisions you're making and the things you're using to help you get through this. And maybe you want to stop something. Maybe you want to decrease the use of something. Maybe you want to put something on pause, or maybe you want to replace it with something else. So just think in those terms. It's going to get us through this. If you want to join the conversation, you can send your questions to our Loveline DM page, or you can tweet them to #I'mListening. But right now we're going to be joined by Jessimae Peluso, comedian and Sharp Tongue podcast host. What's going on, Jessie?
How are you?
It's been many, many years. How are you?
It's been many years. I was laughing while you were talking about self-care because I do have some tequila.
But that's our girl. That's how you do. That's okay. Look, we're not anti-alcohol. We're just paying attention to the way we're using it, right?
Yes, and I'm normally not a day drinker, and I've not been getting just sloshy drunk in my house, but I am enjoying not being judged, wearing sweatpants, and having a day tequila.
You should see the things I'm wearing at home when I'm off air. So yeah, don't be fooled, everyone, by the dress shirt. I got nothing much on otherwise under this. I want to start though by asking you, how's your mental health?
It's better than ever. I've taken time in this quarantine to talk to myself more, because self-talk is so important, and the way you communicate with yourself is the way you communicate with the world. And I've really realized a lot about myself, and every day is a new chapter in the book, a new chance to communicate clearer and to be more honest with yourself. And I've been working out more, which is strange because I'm doing it in my living room with my dogs climbing all over me. It's not goat yoga, it's like pit bull yoga. My dog humped me, so I don't know what that means. There's some boundary issues in the household, but we're doing great.
Like I said, it's care and compassion. We're letting go, a little more freedom, whatever the dogs are needing to do. We're just letting them have at it right now. Humor. Let's talk about it. At a time like this, I think it's really powerful for us to find jokes and humor and distractions and breaks. But some of the people I'm having on the show, they're talking about a lack of motivation. Anyone that's following you on social media, you are not lacking in motivation. You are still maintaining the humor. Where's that coming from for you right now?
I have a general joy in bringing people joy. Okay. That's like the simplest way I can put it. I love being a goofball. I love using my body in weird ways to make people laugh. That's how it started as a kid, and now people need it more than ever. And me too. One of the things that I did most recently that I had so much fun filming was the Phil Collins challenge.
Whoa, that's a flashback. I'm a huge Phil Collins fan.
Yeah, and in the air tonight where it goes, you
Epic.
shut all of your cupboards.
I'm not ready for that. I'm not ready for that.
Oh,
So wait a
you
second.
are.
This is something that's gone viral?
Yes, this is something that's gone viral. It's called the Phil Collins Challenge, and you put it to that point in the song where the drum beat kicks in, and behind you are all these open cupboards, and you have to shut the cupboards in syncopation with the beat, and it's very difficult.
These are the things we're doing. And that's not the tequila talking, right? I find out about trends about a month after when they're not cool anymore. So I'm going to have to like get on it tonight or this weekend or it's gone.
Please don't, because you're a doctor. I want you to stay being a doctor and stick with your expertise. Let me tell you about the trends a month later so you can focus on mental health.
Thank you. You're carrying that because not only that, but you're also really good at your Twitter handle names. You switching them up. Like I have some good ones. Like I think the Queefy May one. Like that's old school. Remember that?
I might have to bring that back for you.
Please, for me. It's like a little shout out.
Thank you. I got self-conscious because Joe Rogan made fun of me. He's like, Queefy May, really? And I was like, rude. I'm putting it back. I'm putting it back on.
Where can people access humor right now? Because that's something I'm working with. I'm still doing telemedicine. So I have clients I'm still seeing via phone and Skype. And some of them are saying like, it's really hard for them to drop into that. They're trying to find it in movies. What resources would you say they should go to? I mean, obviously Sharp Tongue Podcast.
Yes, Sharp Tongue Podcast for sure. If you want some real, raw, and candid conversation with me and my comedian friends, please check out the Sharp Tongue Podcast. Honestly, as much of a cool person as I want to be portrayed as, I think reading humor would be a great way to reconnect your brain with just remembering what humor was, because it's such a great, healthy way for your brain to map out scenarios and situations, especially if it's like a novel. Nonfiction's a little bit different. It stimulates different parts of your brain, as you know, because you're a doctor. I'm a doctor on Mondays on my Instagram page, but
it's Thursday, though, so.
That's true. I'm not a doctor today. You're one every day. I'm a fake one on Mondays on my IG page.
I love that.
Podcasts are a great source for sure.
Yeah. Well, apparently I saw that Amazon is sold out of podcast mics and equipment, and I was partly thankful to hear that.
I actually just purchased a new one to upgrade my system, so I'm probably the one that put it over the edge.
Thank you for that. But it's funny, like right now, people aren't really necessarily taking seriously the tension that we're carrying. I mean, we can't go more than a few minutes without encountering something really stressful or anxiety inducing. And so I'm telling people to like build into their day moments of joy and humor. And I'm literally asking my clients, and it's interesting to see right now how the questions shift, but I'm saying to them, like, what is your self-care practices? And then I'm saying to them, tell me what moments of joy you've had this week. And some clients are literally not able to share with me many moments. Are you tracking that for yourself outside the humor? Are you also focusing on the self-care too?
It's so funny that you say that because of this quarantine, I have found myself enjoying moments more. I walk my dogs. I have 3 dogs. I walk them myself. People ask me for a business card because they just assume I'm a dog walker. I might have to become one during this quarantine. No. But I found myself slowing down. If we want to get like metaphysical and maybe even mysterious with it, I think the universe is asking us to slow down a little bit. And I've been answering that with slowing down and just being more in the moment. I've actually enjoyed picking up my dog's poop. I've enjoyed just sort of sitting down on a bench, even though I'm a little scared. Sometimes I'm like, is there COVID germs on here? But then I'm like, girl, don't worry about it. You're fine. Everything's going to be good. It's all going to be okay. I've definitely have found more ways to slow down, eat healthier, even though I did have chicken parmesan last night, but it was homemade and most of the stuff was organic. Shout out to that organic cheese. And I've also been reading more. And I think, like I said earlier, that self-talk, there's so much time that we have in our hands right now that how we use it is really important. And I think sticking to a routine and implementing some healthy self-talk can really keep you going and motivate you to implement more healthy things into your life.
Yeah, you threw a lot in there. That was beautiful. I mean, the first piece about slowing down, we're encountering parts of ourselves we haven't before, right? Because a lot of the distractions are gone, the coping mechanisms we might have utilized before, like going to the gym or friends' houses or bars. And so we have to be with ourselves. or not. I can't. Oh, bless. Yes, we want to be present to whatever's coming up for us, not being afraid of feeling the feels. Jessimae. But, again, that was actually a really beautiful example, though, of like, we have to hold both. Feel your feelings, be present to what's happening, join humor okay as well, find the humor, whatever's happening. Like what's happening around us. I just saw in New York City, they were saying, looking at the antibody test, that 20% of New York residents have had COVID in some capacity. And it's like, that's heavy, but we can also still kind of take moments away from that and laugh and ground ourselves. And that's like what mental health requires. So we're watching you literally do that live right now.
Absolutely. And I think you made a good point about, talking about people having fear. You mentioned something about fear earlier. I think it's also really important how you digest your news and where you're getting your news from, because so much of that is based on fear mongering. And maybe if you need to keep up to date what's going on, get a little bit in, but then go about your day and do what you need to do. NPR is a really good daily podcast right now that I think it's called The Daily, where they give you a 15-minute bit on what is the most up-to-date information with the government, COVID, and all that. I listen to that, and then I'm on to, walking, hanging out with my dogs and exercising and maybe having a slice of tequila. That's right, I said a slice.
I appreciate that. Check in, check out. There's a lot of other things to do through the day. So we had some questions that came in. I'd love for you to answer them with us. This one says, and again, for those who want to join the conversation, you can do so by sending your questions to our Loveline DMs or by tweeting at #I'mListening. And this question asks, if someone's taking forever to respond, they're probably not interested, right? Like, what could they be doing? Everyone's at home isolated. So we want you to put on your doctor's cap. What do you think that's about, Jessimae?
Okay. The person who's not responding the most in that message is you to you. You are not loving yourself enough because you're going outside of yourself, your being, your emotions, in your core to look for love that you already have within yourself. You're asking somebody else to validate you. They're not responding. That's the answer. That's the one thing I always tell girls. I'm like, he doesn't respond. What? Why isn't he responding? What is he? What's the message? That's the message. He's not responding. There is your answer. And so where he's leaving you in silence, you should fill it with maybe a cooking class. The time you're spending waiting for him to respond. Learn a new language. There's Babbel. There's all these great apps. Duolingo. You can learn how to cook. I bought a crock pot. There are things you can do to fill your time. So don't fill your time waiting for somebody else to fill their time with you. Fill your time with you.
I think that's beautiful. Everything's a communication, verbal, nonverbal, hear it, move forward. We have the apps now. You have access to hundreds of thousands of people from around the world, so don't stay stuck. Here's another question I'd love you to answer with us. This one asks, if someone's I just asked you that one. Sorry. This one asks, love your podcast. You're hilarious. Is podcasting a good way to get into comedy or vice versa? Curious to know about the podcasting realm with all this free time. I'm big on humor.
I don't know if podcasting, well, first of all, thank you. I appreciate you listening to the podcast. That means a lot. At least someone's listening. I think the best way to get into comedy, if you want to do comedy, is to get into comedy. It's a little bit difficult right now because of the quarantine and the regulations and limitations with us being in public. But podcasting is a great way for comedians to sort of exercise that conversational muscle that they use so often on stage. But I will say that stand-up is a totally different ball game. In podcasting, for the most part, you don't really have an immediate audience to give you a response, so you just say what you want to say. But on a stage, if you suck, they'll let you know, and it hurts. Any comedian that tells you it doesn't hurt is lying.
I can't imagine
that.
But what would you say to people that want to try something new now while at home? Because I think now with all the time and they keep pushing back the shelter at home order, do you think that now's a time to start a YouTube page or to get on Twitter and try to practice that?
Yes, absolutely. That's a great idea. I think now with all this time, if you're somebody who's creative, if you're somebody who's good with editing, or you have an eye, like, some sort of like photography eye, put that together and make videos. And things that go viral on the web, sometimes they're people that are just throwing stuff up there, not with any intent to create or garner an audience. Sometimes it's just a happy accident. So if you actually have skill and talent, do it. Get those microphones, get that headphone, get the laptop if you can afford it, or if you already have it. Podcasting is just having a POV. If you have a point of view and something to say, do it. Get it done. I mean, murder's popular,
Jessimae Peluso, thank you for being part of our show. And please look out for my Phil Collins challenge. It's coming this weekend.
Please do it.
Inspired by you.
Dr. Donaghue, please.
Thank you for being part of our show. Have a great night.
Thank you so much. This is the most organized live show I've ever been on, so kudos.
Thank you. And I love that. I mean, right there, the humor, it gives our nervous system and our neurology a break. And so I want people to be focusing on taking time away from the news and all the other stressful factors. We have another question that came in, and this one asks, how can I transmute the fear and anger we are all collectively experiencing as one? Wow. That's a big psychological term there. I'd say a few things. Right now, we're all experiencing a lot of the same emotions, a lot of the same anxieties, a lot of the same stresses, a lot of the same uncertainties, and we're all kind of sitting there and doing the best we can. You know, I'm listening is all about us being present to what we're feeling and not having anxiety about being honest and authentic with what's happening and expressing that to others and letting them express that to us. So I'm all about the authenticity of what's happening. I don't want us to try to repackage or re-narrate or change what's happening. That's also what can take us into trauma. And so feel what you're feeling. Be present to what's happening. Don't ruminate in it. Right? There's a time and space for that. There's also time and space for us to transition out of that and acknowledge all the other things that are happening around us. So don't allow yourself to stay stuck. But I want us to feel what we're feeling. And that's really what's going to be valuable and help us get through this. We have another question. This one asks, I was taught to hide my emotions as a kid. I feel like I want to cry, but never do or can. I know crying is a good stress reliever, so how do I allow myself to cry? It sounds strange, but it's a lot harder than it seems. This is a beautiful question. Very few of us have been raised with permission and space to cry. A lot of people that are male identified, it's even harder. It's often seen as something that's not allowed for certain gender expressions, but I think it's beautiful for all of us. And again, right now is a really beautiful time to practice that. There's a lot of things that are happening that warrant some sadness and some tears. So I would say, first off, just acknowledge when you feel like you want to cry. Consciousness is the first step in behavior change. Maybe you're not necessarily going to be crying in front of other people, although that would be a beautiful long-term goal. But right now, just acknowledge when you feel like you want to cry and see how close to that you can get. Maybe that leads you to some tears while in private. And then at some point when you're around someone you feel very safe with, you can try letting some tears be shed in front of them. And that's really when we can work out of that shame. Shame is maintained when we hide something or hold it back. But if we can be present and allow it in front of someone else, that's really how we know we've worked through that and pushed through that. So practicing it. That's something I was saying on Loveline that I was practicing and making a goal for last year is more crying and more crying publicly. So I think that's a really beautiful, valuable goal. All right. Now we're going to be sitting down and talking with Dr. Kristen Gibson, molecular food safety and microbiologist. Welcome to the show. How are you?
I'm good. How are you?
I'm doing really well. I want to start by asking you, how is your mental health right now?
So I have 4 kids, 6 and under.
Enough said.
Yeah. I have 7-month-old twins and we're all in the house.
Wow.
And I'm trying to do my job. So it has been tricky, to say the least. So.
You're smiling. You're sitting upright. You are half the battle, right?
I have a nice top on. I can say that.
There's no food on your face. But again, we joke, but I'm really trying to tell people, like, hold the bar, midway, let go, have the expectations a little lower. We're doing the best we can. So I want to talk about safety because the whole purpose of the show is mental health. And us feeling as though our basic needs are getting met and they're getting met safely is how we're going to kind of reduce the anxiety, not come out of this with a lot of trauma. And so I wanted to talk about that. I know for me, I'm one of those people where I'm not usually hyper anxious about germs and viruses and bacteria. Coming out of this, I've learned I definitely need to wash my hands more in general, right? So that's been great. But with going to the grocery store, I know that I feel anxious at the idea of it, and I feel anxious when I return home. So help us have a new perspective on that. What should we be worried about? What should we be considering?
So, I think it's good to be hyper vigilant right now. There's nothing wrong with that, especially if that helps you work through this time in your life and trying to figure out how to keep yourself and your family safe. So going to the grocery store, I follow a couple of rules. Basically, I go first thing in the morning because I can, right? Some people may not have that luxury. I do watch where I'm walking in the grocery store, but I don't wear gloves or anything like that. I do wear a mask. and I get my things. I use the self-checkout, and I use my knuckle to punch the buttons, because, we touch our face with our fingers and our hands a little more, but you rarely ever touch your face with the back of your hand. I get home, I unload my groceries like I always would, and then I wash my hands. And that's the best I can do. And I feel confident about that just because I am a microbiologist and I understand how these viruses may behave in the environment. And honestly, we hear about it being on surfaces, but that's not concern. It's really when you're interacting person to person. So if you're avoiding that interaction in the grocery store, and you're not, there talking to someone for a long period of time without a mask, or even with a mask, but really without a mask, you're really going to be okay. I don't think there's any huge concerns, to have. And I know a lot of grocery stores are trying to address people's anxiety by having like one-way aisles, right? Counting the number of people that are coming into the store so it doesn't get too densely populated, providing the wipes and stuff, which will actually kill the virus. They are effective.
Okay.
So you can have confidence in that. So honestly, I think it's really what makes you feel good and what makes you feel safe are behaviors and the actions that you should do.
And that's the mental health piece, right? Because it used to just be going to the grocery store. And now for a lot of people, it spikes their anxiety and it's energy zapping, and they feel exhausted because they're encountering something that feels bigger than them. So I like what you just said. You use words like, I do the best I can do. And you kind of right-sized it, which I think is really great for our listeners and our viewers to hear you say, is that it's more about your interaction with other people, not about having anxiety around food or the supermarket.
Mm-hmm. Yes, I would say that's absolutely perfect way to say it.
And just speak to this. So we've had some guests on that were talking about nutrition, and we're talking about the importance of eating as nutritiously as possible while giving yourself a little bit of a break, and how that's the perimeter of the food. But often those healthier, nutritious foods aren't packaged or in plastic. So it'd be important to hear from someone like you that is still safe. Don't panic around those foods.
Yeah, so I wouldn't panic around the foods that aren't packaged. So, I mean, I buy apples all the time. I don't have a concern about the virus hanging out on the apple for any long period of time if someone like sneezes or cough. But I do also know that ingestion of food is not going to make you sick with this virus, right? It's a respiratory virus. So you actually have to inhale the virus particles. And so that's kind of how I think about it. You can also peel an apple. So if you're concerned about something being on the outside, a lot of them have outer peels that you can just take off. If that's something that you're not convinced that I know what I'm talking about, or other people may not know what they're talking about. But I think the risk is really, really quite low to eating those kind of ready to eat fresh produce that aren't packaged. I don't see there being a higher risk. And like I said, you could wash it, don't wash it with soap. Don't listen to the guy who said wash with soap. You can wash with water and you can peel it. And that could make you feel like that's a better decision or choice for you. But we don't do that in our house.
Okay. So nice to hear about what you're doing in your home. I think that reduces some people's anxiety. And also, like you said, if it's going to make you feel better, get things that can be peeled or something can be taken off the outer. Let's speak just quickly also about the idea that some of us are living with people that are going out into the world and then coming back. Not everyone's self-isolating with someone that isn't going to work. What are the things that we need to think about or discuss with those people that are leaving and coming back so that we feel safe when they return home?
That is really tricky because I think about that all the time when we've had to go to, say, the doctor's office, and our pediatrician has been there through this whole thing. They're putting as many extra measures in as possible, but she's going home to her family every day. And so I think about, the people that are doing that, it's just, they probably have to, if they have a room to isolate in, they should probably be doing that more frequently if they think they've come into contact with someone who has COVID-19, or they have, someone who's confirmed with it. I know a lot of places now are opening up hotel rooms, so these people can go into a place for free because they've been on the front lines and they can keep their family safe at the same time. That may not be an option everywhere, but if you are at the front lines of especially healthcare workers. But if you just have to go to work, say you're a food worker, I mean, you're interacting with people all the time. And so it depends on the company and what their rules are. Are they giving you the proper PPE? Are you wearing gloves? Are you being able to wash your hands as frequently as you should and take care of yourself like you should? That's a really difficult question for me because I'm thankful every day that I'm not in that situation. Because I think I would have a lot of anxiety if I had to go into work with other people. I can't control what other people do, but I can control what I do. And I would feel a little frightened, honestly. That may not be what you want to.
No, so maybe, but
say,
no, I appreciate the vulnerability. Maybe that's the conversation, is to talk to the loved one that's leaving about what precautions they're taking, so we know that they are taking some, so as to feel safe with them coming back. Because I think maybe the individual should sit down and have that talk, like, what are the boundaries, making sure we're all following them to kind of reduce that anxiety, because it is kind of a trust factor, right?
Yeah, I mean, you have to trust that everyone who goes out in public is not going out like if they think they're sick in any way, right? And so if this person has to go to work, then hopefully they're going to work with people who have that same mentality, that aren't showing up to work, who could have been exposed or maybe sick, So we should all be really thinking about the greater good, right? Like, what can we do as a community, which is what a lot of places are doing right now to protect each other. So I think that's the key. And it's hard. It's super hard to trust that other people are doing the right thing.
It is. I have some questions that came in that I'd love for you to answer with us. This one asks, my husband always wants to eat out, but I'm too paranoid these days. Am I being crazy, or is it okay to think that there are likely people preparing our food who have COVID and don't know they're passing it to customers?
Yeah, so food preparation is an interesting thing because it's really unlikely, even if that person had COVID-19, that they would be passing it to your food, and through eating that food, you would actually get sick. It just isn't the way the virus likes to live or behave. It's not its route of infection. So it's just not something that is considered a high risk. The risk is if the delivery person, say, that you're ordering food from, has COVID-19, and you sit there and have a lengthy conversation with them, or they cough and sneeze on you as they're delivering your food. Clearly that's a risk. And so you would hope, like, you should maybe wear a mask when you are interacting with that person that you're getting food from, or that person, hopefully the delivery person, should be protecting themselves from the customers as well. So I don't think anyone should have concern about contaminated food. It is the person that you're interacting with specifically that would be the potential source of getting or transmitting that disease, not the food itself.
Okay, very clearly said. And I can feel in my body I've relaxed because I get a lot of delivery, because I like what you're saying. I wear a mask. They're often wearing a mask. They have gloves. I'm using a cloth to open the door. And so thank you for clarifying that. I have one final question. This one says, I have a newborn and a teenager in the house. Uh-oh. And the teenager's been doing a lot of the shopping and going out for things. Are there rules I need to set to make sure he's not bringing in any germs from outside that will harm the baby?
So it's really unclear, like, what's going on with that younger population, right? Like, we really don't know. However, I think teenagers and people who interact with babies should follow the same rules they pretty much always should be following with newborns. They're so susceptible. Their immune systems are not developed. And we can pass a lot of things on to newborns. So it's really washing your hands. You shouldn't be touching their mouths with your hands, touching their hands with your hands very frequently, kissing them on the mouth or close to the mouth. Like, those are all risk factors all the time. So it's really, everyone probably is tired of hearing, wash your hands, but hand hygiene is the best thing that you could possibly do. And just make it a habit that you adhere to all the time. And newborns, that is no exception, within a pandemic era or not. You should always be doing that when you're living with or visiting a newborn baby.
I mean, if nothing else, the hand washing, hygiene skills have improved, and we're all coming out this better because of it. Dr. Kristen Gibson, thank you so much for your time, for being a part of our show.
You're very welcome. It's great to meet you.
Be well. Bye-bye. And I like that. I mean, again, we're focusing on mental health, and I want us to be able to breathe and let go a little bit and know that as long as we're keeping 6 feet away from other individuals and wearing masks, we don't have to have anxiety about the food choices we're making or the foods we're eating or going out into the grocery stores. And I've been out at the grocery stores, and they're being very thoughtful about maintaining the distances and physically keeping people separate. So go grocery shopping. Don't let your anxiety spike over that. Just be very thoughtful about what you do when you return home. If you want to join the conversation, you can do so by sending your questions to our Loveline IG page or by tweeting at hashtag I'm listening. I have a question here, and this one asks, how do I help someone who's chain smoking because they're bored? It seems like it's getting worse. I can't tell them to quit because they're very defensive, and it causes me stress. I like the word used there, stress. We are not trying to stress each other out right now. I would say you've lovingly shared the concerns you have. They're an adult. Back off. Right now, that might be the best they can do. When we come out of this, we can revisit that conversation. I'm absolutely not recommending smoking as a, coping mechanism or self-care, but people are where they are right now. And again, we're trying to reduce conflict. I'm assuming this is someone you're self-isolating with. So you want to keep, safety at home. You've brought it up. They're not down to hear that from you. So I would just lovingly back off. And sometimes that's part of being in a relationship, just having to witness people making decisions we're not comfortable with. So again, focus on just maintaining some peace at home. This final question asks, is there a relation between feeling mentally sick and physically sick? I notice when I'm struggling with mental health, I also feel physically sick. Is that something that happens? Yes. We can absolutely somaticize some of our emotions and feelings or psychological struggles, and that means we take it into our bodies, or our bodies are the first part of communicating that something's wrong. I work with a lot of my patients on checking in with their bodies to let them know whether or not they're feeling anxious or stressed, or more importantly, safe with the people they're around or the relationships they're in. Our body's a beautiful communicator if we listen to it, and our body and our minds are powerfully tied. And that's why we talk a lot right now about mental health being tied to our physical health, and all the physical health decisions we're making also supporting or eating away at our mental health. So we got to always be paying attention to both. That's why I talk about nutritious foods and exercising our bodies, but also exercising our minds and being, thoughtful about our emotions. So that is our show. We'll be back at 5 p.m. Pacific Standard, 8 p.m. Eastern. You can check out all of our old episodes on the radio.com handles. Send your questions to our Loveline IG page or tweet at hashtag I'm listening. Thank you all for hanging out with us, and you all have a beautiful, beautiful night.